How, Danny? It's nice to be here with you. Yes, now, as an acupuncturist, I have always given a lot of care to the encounter with the patient, of course. And not just because I am a psychiatrist and a psychotherapist, but because the clinical relationship is, as we know, part of a chi. And also classics give much importance to this side of a treatment. So in the last few years, I started thinking that I had something I could say about it. I've been working as acupuncturist for 40 years. So I started to teach and to write about it. And the point is that I think that needling has an intense quality, and our work is a delicate matter. And patients can be very demanding. It is their right. But our task is to respond as best as we can. So at the same time, most of us, we are not saints. And we do sometimes, or often, get angry, exasperated, bored, confused. And we do sometimes feel frustrated or inadequate or incompetent. So I think that it's important to look at all of this. Now, I don't think there are rules to stay in all this, but it's important again to recognize what is going on. That is what we can learn and should learn. I don't think it's our duty to love immediately all the patients, but it is our duty to develop a therapeutic space the best we can, both in the clinical interaction and inside ourselves. And I insist specifically on the inside of our clinical attitude, which is not, not so valued, I'd say, in our very active young society. So, talking about how to really listen, take the time to wait, not give immediately an answer, abstaining instead of intruding, imposing what is good. The idea is to leave some empty space to receive and to let things unfold. This is what they call an empty heart and wu wei, not doing. So maybe we can put into practice a little bit of this wisdom, I think. Yes, these issues were already in Shen and in pediatrics. Both books, the two books that were translated into English. But I give them all the space in this, my last book, that now has been translated in English and will be on the market shortly, I hope. So in there, I take care of ethical behavior, treatment frame, with the daily problems we may have with time or money or whatever. Some key points for the interview, clinical interview, but mainly, again, how to deal with the difficult situation. So with aggressive or exhausting patients. And I try to explain all this mainly through clinical cases, a lot of them. So, I say how I felt, what happened, what I did, what means what I did, and so on. I must say that sometimes it was not so easy. It's very personal. But I hope really can be of some help. So, yes, thanks to you, and really hope to be of some help to colleagues and practitioners. And I hope to have a chance to talk together about all this sooner or later. Thank you.